how being active member of the British civil society, how you found it from the platform of the foundation, how you are countering the propaganda on social media platform.
We're absolutely not okay with the way that the entire community is being stigmatized. So we think that engaging with the media, particularly the British mainstream media, and presenting our perspective and presenting the more positive contributions of British Pakistanis is an important part of what we're doing.
Why there is that mental approach to level baseless allegation?
I must say, unfortunately, there are a lot of bad apples there, and they take these opportunities to pick these up.
What is, by the way, the percentage of such offences, and how police and administration is dealing with this?
The Home Office has already highlighted that 85% of this was carried out by young white men. 85%. Exactly. So if there are about 100 people, 85 of them would have been white, ethnic, race, etc., and then blame them for this. This is purely a bad human behavior. This is a criminal act.
How the British authorities, sitting cabinet members, Prime Minister, how they are responding to this particular challenge.
And I think one of the things that the British government can do, I know they're doing it in pockets, what they can do is that they can reach out to the right people.
Bismillahirrahmanirrahim. Hello and welcome to program Inside in V News English. Dear viewers, in British society, in United Kingdom over the past many months, there is a systematic campaign against Pakistani community. And when we talk of Pakistani community, there is a huge Pakistani community comprising of different ethnic backgrounds, including people from Jammu and Kashmir and largely people from Pakistan. This Pakistani community is very active part of the British society. There are doctors, there are engineers, there are teachers, there are businessmen, there are politicians. There are people also of Pakistani origin who are part of media, part of police, part of government service. And they are really contributing into the socio-economic development of not only United Kingdom, but they are also closely aligned with Pakistan since they are of Pakistani origin. So, and they're also playing a vital role, a role of a bridge between Pakistan and United Kingdom. But unfortunately, there is a systematic campaign that we spoke, and that is against them, that allegedly they are part of the sex grooming gangs in United Kingdom. Over the last many months, social media has been filled with such fictitious, baseless propaganda about Pakistani community. Recently, the police commissioner's briefing in London exonerated Pakistani community, and he made it very clear that most of the sex offenders belong to the white community. So what is this happening about a society which used to be considered one of the finest with values, with these all things? Why such moral values? Why such things are declining in British society? Who are the elements, who are the far-right elements who are particularly involved in this? And today we are fortunate to have with us two very active members of British civil society. One, Mr. Dr. Shahid Latif. Dr. Shahid Latif is a consultant psychiatrist and have done practice in Ireland and in England over the last many, many years, and very active part of the British civil society. He's very active part of Pakistani society in United Kingdom. And we are also joined by Faria Ali. Faria Ali is also a very active member of the civil society, and she's also the chairperson of British Pakistan Foundation. This foundation, Dr. Shahid Latif is also part of this foundation. This foundation is carrying out different socio-economic welfare projects, not only in Pakistan, but also providing mentoring, training, many other things within United Kingdom and also in Pakistan. And Dr. Shahid Latif and Faria Ali, we warmly welcome you in our program Insight in Videos English. And I'll start with Dr. Shahid Latif. Dr. Shahid Latif, sir, you have been living over there perhaps more than 2 decades. So approximately 25 years as I've seen and read your profile. So tell us that when this campaign started actually, these baseless allegations against Pakistani community that sex grooming gangs mainly belong to the Pakistani community. Who were the elements who were behind this, and how this systematic campaign was spread in different parts of United Kingdom? Dr. Shahid.
Thank you very much, Mateen Saab, first of all, for the introduction and inviting us to We News. It's really important that people like myself and Faria and other people who are contributing towards the British society get an opportunity to speak and have a platform on the media where we'll be able to talk about the positives rather than when these negative elements come in. Just to reiterate a bit about my background, I was actually born in the UK and had the opportunity. My family migrated back to Pakistan when I was 15 years old, so spent a good 12, 13 years in Pakistan before returning back to the UK. So you're absolutely right. I've been in the UK for over 20 years now. It's very, very unfortunate, obviously, to talk about such elements that have come to the fore when we should be talking about or celebrating, the good things that British Pakistanis are providing or have contributed towards British society and fabric. But unfortunately, this is not something that is new. It's something that happened before, about 1.5 to 2 years ago, when the previous Home Secretary raised this issue at that time. I'm talking about Suella Braverman, when she raised the issue about focusing specifically on a certain ethnic, cultural element of this horrible criminal behavior of sex grooming and child sexual abuse, etc. And despite the fact that, obviously we totally condemn this act, and I think those who are actually the criminals who get involved in this should be punished with the law of the land. Having said that, the other element which is missing with all this horrible narrative and rhetoric that's happening is what's been taken away is the focus on support for the victims. Me being a psychiatrist, I see people who are victims of sexual abuse all the time, and our focus is always around making sure that we provide support not only for the victims but their family and friends, etc., because it affects not just the victim but those around them as well. So it's a real shame. And though I don't want to, and we would never want to make this a religious, a cultural or a ethnic issue, but when certain names like British Pakistani men, I'm a British Pakistani man, I'm very proud to be British, part of British fabric, I'm very proud to be Pakistani, and I think I champion both cultures. I'm sure Faria as well. So it's something which obviously we don't want to hear, because despite the fact that we condemn this issue, and despite the fact that 85% of this horrible criminal behavior was perpetrated by what the Home Office has stated as white males, which we don't want to go down the route of. But when the narrative or rhetoric starts that this is a British Pakistani thing, then I think it's an opportunity. It's unfortunately we have to speak up, and if people like us don't speak up, then obviously it's things can go very pear-shaped. And we know in the past when if we haven't spoken up and it's in the tabloids, it's taken as a label, and we do not want that to become a label for British Pakistani men in any shapes or measures.
Faria Ali, you're also very active part of the British Society, and we got the introduction that you're also running an organization, British Pakistani Foundation. I will mainly seek your comments for our viewers who would be definitely watching this program internationally. What is two aspects? What is the role of social media, and what is the role of traditional media? Print media and electronic media, which is centuries-old media. What role these established newspapers and television channels, what are they playing? And we understand the power of the social media is very, very strong, it's with a huge influence. So highlight both things, and how being active member of the British civil society, how you found it from the platform of the foundation, how you are countering the propaganda on social media platform, and what regular media is doing on this whole issue.
There are a number of things that we are doing, and we haven't started now. We started when the statements first came out, Suella Braverman, about a year ago. In my capacity as chair of the British Pakistan Foundation, we're now taking that forwards. At the time, we've written to the Prime Minister to condemn the statements of the Home Secretary. And this time around, we've done a number of things, including engaging with mainstream media in the UK. So For example, last week I was on BBC Radio 4, which is a prominent radio station within the UK, talking about the Pakistani voice, the Pakistani perspective, the fact that whilst we condemn what's happened in certain pockets within Pakistani community, we're absolutely not okay with the way that the entire community is being stigmatized. So we think that engaging with the media, particularly the British mainstream media, and presenting our perspective and presenting the more positive contributions of British Pakistanis is an important part of what we're doing. But I've said this before and I'll say it again. The British Pakistan Foundation is just one part of what needs to become a wider movement to advocate on behalf of Pakistanis. And so the other thing that we are doing is essentially putting out a message to the 1.8 million British Pakistanis in the UK to say, join us, become members, and together we will become a voice for change within society to push back on what is an extremely dangerous and divisive rhetoric that people in positions of responsibility have really started to push.
Dr. Shahid Saab, I would seek specific comments from you. In religion of Islam, mosque plays a very important role, particularly Friday sermons, focus on many things. Same as in the Christianity, the role of church is very important. Please highlight that what these two important institutions are doing, whether these both institutions are very active in disseminating a positive message, in countering this propaganda. Please share your thoughts on the role of church and on the role of mosque.
Yeah, no, thank you. Obviously, I can talk about the role, probably not got the religious element to it. I'm not an Islamic scholar, but from my, I can give you from my example, or from my experience rather, that being a mental health specialist, apart from my day job, I also chair the British Pakistani Psychiatric Association. So there's a lot of work that we do in the community. And one of our allies, which we always found is really helpful when we do raise the profile or try to remove the stigma or raise the awareness of mental health, what we try to do is we reach out to community leaders and imams, scholars in mosques, and I think priests and leaders within the church folk, they play a very crucial role. And in the mosques you have a large number of mass of people going, so people do listen. So I think utilizing that platform is so important. But as we know ourselves, we know for a fact that even from a religious perspective or the mosque perspective, there are differences and variations. And I've had varied experiences in my connections and my dealings and networking with mosques, that some mosques do entertain and are very open and very sensible in their approaches as to how we work collaboratively to put that message out, while other mosques can do a little bit more work. So, I think the point that you raised, that the role that they should be playing is crucial. It is crucial. And the same goes for the church. It wasn't long ago that, the issue about abuse going on in churches, again, it was a horrible thing, but then we should not stereotype that all churches or religions are like that. But there was something that was going on. It was highlighted. And I think the church has worked very hard to dispel that myth that all churches are the same or religious elements are the same. So I think churches, and not only churches, but churches, mosques, gurdwaras, temples, synagogues, etc. I think all of the religious elements, I think we don't utilize that platform enough. I think organizations like the British Pakistani Foundation are very keen to utilize that platform, and other platforms as well, where we have a wider connectivity and wider engagement with the community for the sake of meaningful engagement.
Dr. Saab, since you are a person with very important and sensitive subject, psychiatry, and you are a psychiatrist, so tell us that what prompted far-right elements to indulge in this extremely unfortunate campaign, which is very damaging for a particular community. What happens? Why there is that mental approach to level baseless allegation and finally prompting the police chief to come and speak on record that it's not the fact. The fact is that the far-right elements with the white community, they are indulged this. So why this mindset is there? What happened actually?
Yeah. This goes back not just 10 years or 20 years or 30 years or 40 years. We have to understand human behavior. And humans interact. They are either, humans can, there's a concept which we call in-grouping, out-grouping. There could be securities, insecurities. There could be them versus us. So these are very negative elements where majority of the people, I must say, majority of the people do not indulge in. Many people do sit on the fence, but there's a handful of some people who believe in this is our area, and anything else that comes into that area or into that sphere should not be allowed. And if they do enter, we must focus on the negatives to shove them away. The right wing operates in a very, very simple, in a similar way. And no matter how much one tries to converse with them, no matter how much one tries to communicate with them, it's a struggle always. It's always a challenge. This is ammunition. This is feed. This is, this is something that music to the right wing's ears, some to hear, because they will now feed on news like this without, talking about logical, rational, just having those academic discourses. They don't believe in those. So we have to find the right people. The majority of the people in the indigenous population are people who want to listen. They want to live peacefully. They want to live in harmony. They want to have academic discourses. They want to have discussions and understand one another's cultures. One of my areas of interest and experience is cultural mental health. And one of the things that we do in cultural mental is understanding each other's identities and cultures and backgrounds. And as a result of how do we present ourselves, the basics of all human behavior is the same. But there are bad apples out there. And unfortunately, the right wing, I must say, unfortunately, there are a lot of bad apples there. And they take these opportunities to pick these up. And basically, and anyone who is not in the right wing who actually highlight this is actually giving bait, is actually giving feed to the right wing.
Whosoever is with whatever ethnic background, if those elements are involved in such things, although the police chief's press briefing exonerated a particularly Pakistani community, what is, by the way, the percentage of such offences, and how police and administration is dealing with this? Is police taking prompt action against such offences when it is reported? And the people who are indulgent in such things, they are punished by the court of law?
Yeah, no, thank you. That's a very good question. Now, the way this, obviously, first of all, again, like I said earlier on, I don't like talking about blaming ethnic or culture or race into this, but because this is the conversation which is on the, at the forefront, the Home Office has already highlighted that 85% of this was carried out by young white men. 85%. Exactly. So if there are about 100 people, 85 of them would have been white. Then you break those down into different ethnic backgrounds. Now, within those ethnic backgrounds, around about 2.5% of them are British Pakistanis. There are other people from other countries as well. There's from India, Sri Lanka, Bangladesh. There's others as well. Slightly less in percentage. But again, we've gone down this very dangerous route of teasing out, okay, let's divide these into ethnic, race, etc., and then blame them for this. This is purely a bad human behavior. This is a criminal act. It's a bit like saying how many people in the UK are alcoholics and drug addicts and they have committed crimes. So if we start taking out the narrative and we take out the percentages out of those, does that mean that whoever has the highest percentage is basically, that's a cultural issue then? Somebody asked me a question not long ago, a very similar question, that is this a cultural issue? And I said, no, it isn't. The reason why it's not a cultural issue is that there are a lot of Pakistanis who live in other countries. Have you ever heard of this issue taking place in Australian Pakistanis or Middle Eastern Pakistanis or American Pakistanis? With this very, very low percentage of this happening in the UK, very low percentage, where again, we have to, unfortunately, because it's been raised, we have to defend, but not be apologetic, because that's not the way this should be approached. But unfortunately, we have to wake up and defend ourselves, which is very, very unfair. So you see, when we go down that route, it's a very dangerous route to go down, because it opens up lots of cans of worms, which then highlights other races, and if one wanted to do that. But that's not the way this should be done. This is a criminal act. That's the way it should be taken. Yes, absolutely agree. Even if it's 1% of Pakistanis, I do think there is a role of the mosques, of people like myself, of the British Pakistani community.
So, now coming to this, your foundation, which is at the grassroots level. Tell us the role of the community leaders, how they are responding to this particular challenge, how they are representing community, how they are doing efforts to protect the community and dispel this whole propaganda. Because community level is also one of the effective level. Dr. Shahid Latif.
100%. You're absolutely right. And I think there's a lot of community leaders who are actually very proactively doing a lot of work. The trustees that we have in British Pakistani Foundation, we've got our founder, Asif Rangoonwala, we've got Faria, as you can see, as well, myself, and about a few others who are very proactively. But the other organizations, we've got, healthcare organizations like APNE, which is the Association of Pakistani Physicians of Northern Europe. You got BPPA, which I chair, the British Pakistani Foundation. And then you got, lawyers associations, you've got business and entrepreneurs associations. And there are leaders within those who are not only contributing, but, they feel hurt when they hear such things, because of the contribution is so immense from the British Pakistanis that they feel hurt. But I think one of the things which is currently missing that we should be doing, apart from the fact that we should be proactively out there and supporting and also highlighting the positive, is that we need to proactively go out there and highlight that in the last 6 to 7 decades, what has been the contribution of the British Pakistanis community within the British mainstream fabric. Immediately as a doctor, I know for a fact that the contribution in the NHS, which is the national health system, has been immense. And if it wasn't for British Pakistani doctors, the NHS would have collapsed 20 years ago. It would have literally collapsed. So we have to highlight these things. Again, in the finance, entrepreneur, business, the British Pakistani business community over here have hugely economically contributed. And the list could go on.
And the list goes on. Very rightly, you mentioned that over the last 6 to 7 decades, Pakistani community are people of Pakistani origin. They have not only been part of this National Health Service, they have been very active in politics. They have been very active in academia side. They have been very active on a political side. They have been very good active representation in local unions, also in House of Commons, also in House of Lords. No, I would like to get your comments that since through the platform of NGOs, through community leaders, through mosques, through church, how British government is sensitive about this. This issue has been taken up in the House of Commons, I heard so, and how the British authorities, sitting cabinet members, Prime Minister, how they are responding to this particular challenge.
It's not an easy one. I can understand from a government perspective, but I must acknowledge the government needs to do more. And I think the government needs to be brave enough to come out and highlight and call a spade and say, we are not going to go down the route of this being an ethnic issue, this being a racial issue. This is I'll raise again, it's a criminal behavior, and that's how it should be dealt, like any other criminal behavior. And I think people like us, and you're absolutely right, we've got a lot of British Pakistanis who are politicians. Some of them are elected, some of them are in the shadow cabinets, etc. We've got lots of councillors, and I talk to them all the time, and they are doing very proactive work, and they are very keen to reach out, and they are reaching out. There are a lot of very good MPs out there, a lot of really good non-British Pakistani MPs, British Pakistani councillors, and even in the House of Parliament, our elected MPs. We're always very keen to work. The most important thing is meaningful work. What does that actually mean? Collaborative. And I think one of the things that the British government can do, I know they're doing it in pockets, what they can do is that they can reach out to the right people in the community and say, look, this is what's happening. This is the narrative that's gone out. It shouldn't have gone out. It's gone out. How can you help us and assist us with collecting the data, highlighting the contributions, and moving forward as in the future, if something like this happens again, what would you like to do? What we must never have is we must not have knee-jerk reactions. We must have a plan going forward. And that's what I would think that the British government as a next step should be doing.
Dr. Shahid Latif, if you're living in United Kingdom since long, why there is a huge gap between these Asian ethnic communities and the British white communities? And particularly, we will talk about Pakistani community, how this close partnership, interfaith harmony, and understanding particularly, and when we say people-to-people contact, how these things could be developed and how these misunderstanding, these all apprehensions, fears, this all could be removed, since you are a psychiatrist and you must be having a very good understanding of these things.
I would actually think that there's a lot of good work going on. And that's the very thing I'm saying, those are not highlighted enough. I think we need to be much better at advertising and shouting out louder the good work that's going on. I think over the last many, many years, I remember the UK in the 80s, in the 90s, I was in Pakistan, came back in the 2000s, and I can very much recall how difficult it was and how things were less integrated and how difficult it was. I'm a very keen football fan, and we would never see anyone with my skin or color or background going to football stadiums because over there was seen dangerous, and we were scared of them versus us. But now, if you look at the football crowds, you can see how fantastically it is a family-oriented, and I would call other institutions are the same as well. So I wouldn't completely agree that there is a big gap or the disparage between the indigenous and non-indigenous population. I think there's a pockets of really, really good work. Unfortunately, it's those little things which make headlines, and it highlighted as if there's completely chaos, or it isn't complete chaos. And overall, Britain is one of the most harmonious, one of the most tolerant countries in the world. I have to say that. People who I work with on a day-to-day basis, they're a similar mindset to myself. And our integration within society is, it's amazing. And, the welcome and everything. And the thing is, we don't think ourselves of outsiders here because we are very, very part and parcel of the British fabric. I consider myself very British. Whether you want to take that from a color perspective, if that anybody wants to say because you are not white, this way not British, I would challenge that. But still, having said that, work is ongoing and a lot of work further to do for engagement between indigenous and non-indigenous population. But there's lots of good work going on.
So, Dr. Shahid Latif, in future, how such acts of sex offences, as you mentioned, particularly it's against the minors, boys and girls, how this could be prevented in the future? Who could be playing a very effective role in reshaping the minds and the mindset that this act is against norms, against values, against religion? Please.
Yeah. I mean, if we're talking from a wider perspective, or we're talking from a British Pakistani perspective?
From a wider perspective, exactly.
Okay. So wider, I mean, it's now in the headlines. And I think it's for people who are in positions in power, people who are in positions of influence, people who have the network of influence around them to start doing this work now. I think people who are deeply ingrained within the community, I think it's very important. Leaders I'm talking about, you gave the early example of mosques and churches, etc. We must engage with them because people do trust their community leaders. I think engagement with them is a no-brainer. And I think that's a good starting point. Like I said, it's happening already, but I think we need more of that community engagement. Because one thing which is very dangerous, which is that when we start having a them versus us, or it's us and them, a mentality, that's something that's very dangerous. And the only way that will happen is that if we stop that level of meaningful communication. I'm always very keen as a psychiatrist that one of the most important things, if you want things to happen, is good communication, good levels of communication. And that's what we're always working on. And that's something that we do from the British Pakistani Psychiatric Association, the work that we do, and also from the British Pakistani Foundation. I think one of the things, the reason why I am a trustee of British Pakistani Foundation is because their values actually say what I'm actually saying. So that's what it's stated out, that engagement, the whole productivity around training, etc., and looking forward, how we can support our own, not only the wider community and British Pakistanis as well, and anyone who is feeling uncomfortable with this narrative going out. Let's see how we can support them as well. But I do want to add again that these victims of the child sexual abuse, I think with all this narrative and rhetoric, I think what we really need to do is just slightly re-steer and focus on them and see how we support them.
Exactly how we can support them. One quick thing is that since a particular community was targeted, Pakistani community, and when we say Pakistani community, it is also with the people from Jammu and Kashmir as well. So, since such allegation emerged through different social media platforms, how Pakistani diaspora, Pakistani community, young children, women, how they're feeling? They're feeling quite charged. They're angry, furious. What are they feeling? Being a psychiatrist, please share with our global audience.
It's absolutely understandable that people are going to feel scared. They're going to feel insecure. They're going to feel isolated. They're going to feel it's us versus them. And, different people approach these in different ways. Some people withdraw themselves into a shell. Some people just go quiet. Some people talk and engage with others and do nothing. Other people will be out there and shouting and screaming. So you will get all kinds of people. We mustn't fall into that trap, because this is like a trap. And if we do fall into that trap of negative rhetoric, and I would say this as a psychiatrist, because we talk to our patients all the time, and when we are emotionally charged, and many of our patients who come to us do have difficulties with their emotions, and some of the things that we do is advise them. So similarly here, I'm not saying that people are unwell. I'm just saying what is a normal human emotional reaction, and that could be varied. One size won't fit all. It will be different strokes for different folks. So different people will be reacting in different ways. So we need to be conscious of that. If 3 people are shouting out and become aggressive, that's not acceptable. But at the same time, that may not be the norm either. So picking out those 2 individuals and then stereotyping that as well will not be correct. So a very, very sensible approach to this is required.
Thank you so much indeed, Dr. Shahid Latif, along with Faria Ali. Although due to some technical issue, Faria couldn't continue communication with us, but you spoke in depth about this particular issue, which is in the United Kingdom, and which needs to be condemned, which needs to be countered. And despite your busy schedule, we know you are a psychiatrist and you are a very busy schedule. Despite that, you participated in our program Insight in We News English. And dear viewers, till our next program, goodbye and Allah Hafiz from our studios.
Allah Hafiz. Thank you very much.